Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Gabapentin. Its brand name is Neurontin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it really helps me with the YouTube algorithm. So first off, what will we cover in this presentation? First, we're going to talk about how gabapentin works. We're going to talk about indications or reasons that this medication would be prescribed to patients. We'll discuss contraindications or reasons that this medication cannot be prescribed. We'll touch on examples of dosing, and make sure you stick around to the end of the video where we will cover side effects with percentages. So how does this medication work? Well, gabapentin was designed to mimic the neurotransmitter GABA, but it does not bind to GABA receptors. It likely involves inhibition of alpha-2 delta subunit of the voltage-gated calcium channels. So when would we see gabapentin be prescribed to patients? So we commonly see this medication prescribed in partial seizure as an adjunct therapy or an add-on therapy. And we also see it prescribed for postherpetic neuralgia, which is the most common complication of shingles. Now, in terms of contraindications or reasons we could not prescribe this medication to a patient, the only contraindication would be if a patient had a hypersensitivity or allergy to gabapentin or any other component of the formulation. Now for some examples of dosing. So in partial seizure, the initial dose would typically be 300 milligrams orally 3 times daily, with a maintenance dose of 300 to 600 milligrams given orally 3 times daily. There's a note here that doses up to 2,400 milligrams per day, again given in divided doses, have been well tolerated. In postherpetic neuralgia, we would see 300 milligrams on day 1, 300 milligrams twice daily on day 2, and then 300 milligrams 3 times daily on day 3. And then over time, the dose may be increased up to 1,800 milligrams per day, again given in divided doses. So now, as with all medications, there are some side effects or adverse reactions that patients may experience while using gabapentin or Neurontin. So I'll go over some of those here now. So peripheral edema can happen 2 to 8% of the time. We see nausea come in at a rate of 1%. About 3% of patients may experience vomiting, and about 11% may experience a viral disease. Ataxia comes in at 3 to 13%, and nystagmus, or rapid eye movements, would come in at 8%. Fatigue would fall between 3 and 11%, and 10% of children may develop a fever. 17 to 28% of people using this medication may experience dizziness, and 19 to 21% may experience somnolence. Now, some more rare but serious side effects would be hypoglycemia, or low blood sugar, a dermatological reaction known as Stevens-Johnson syndrome, or an anaphylactic reaction. That's all we're going to talk about today with gabapentin or Neurontin. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.